Hello there and welcome back to the channel. Today we have another very interesting topic lined up for you. Today we will talk about cognitive behavior therapy for anxiety. We will also discuss 5 physical and mental signs for anxiety. Last but not least, we will show you a simple CBT exercise for people who feel anxious. So what is cognitive behavior therapy? Cognitive behavioral therapy, CBT, is a type of psychotherapeutic treatment that helps people learn how to identify and change the destructive or disturbing thought patterns that have a negative influence on their behavior and emotions. Numerous research studies suggest that CBT leads to significant improvement in functioning and quality of life. In many studies, CBT has been demonstrated to be as effective as, or more effective than, other forms of psychological therapy or psychiatric medications. It is important to emphasize that advances in CBT have been made on the basis of both research and clinical practice. Indeed, CBT is an approach for which there is ample scientific evidence that the methods that have been developed actually produce change. In this manner, CBT differs from many other forms of psychological treatment. Following are 5 physical and mental signs for anxiety. Number 1. Generalized anxiety disorder. With GAD, you may feel extreme and unrealistic worry and tension even if there's nothing to trigger these feelings. Most days, you may worry a lot about various topics, including health, work, school, and relationships. You may feel that the worry continues from one thing to the next. Physical symptoms of GAD can include restlessness, difficulty concentrating, and sleeping problems. Number 2. Panic disorder. If you have a panic disorder, you get intense, sudden panic attacks. These attacks often feature stronger, more intense feelings than other types of anxiety disorders. The feelings of terror may start suddenly and unexpectedly, or they may come from a trigger, like facing a situation you dread. Panic attacks can resemble heart attacks. If there's any chance you're experiencing a heart attack, go to the emergency room. It's better to err on the side of caution and have a healthcare professional check you. During a panic attack, you may experience sweating, heart palpitations, feeling like your heart is pounding, chest pain, feeling of choking, which can make you think you're having a heart attack or going crazy. Number 3. Phobias. Phobias are an intense fear of certain situations or objects. Some of these fears may make sense, such as a fear of snakes. But often, the level of fear doesn't match the situation. Like with other anxiety disorders, you may spend a lot of time trying to avoid situations that may trigger the phobia. A specific phobia, or a simple phobia, is an intense fear of a particular object or situation. It may cause you to avoid everyday situations. Number 4. Social anxiety disorder. Healthcare providers used to call this condition social phobia. You may have overwhelming worry and self-consciousness with daily social situations. You may worry about others judging you, or you may be anxious that you'll embarrass yourself or open yourself up to ridicule. People with social anxiety disorder may avoid social situations entirely. Number 5. Agoraphobia. If you have agoraphobia, you may have an intense fear of being overwhelmed or unable to get help. Usually, you have a fear of 2 or more of these environments. Enclosed spaces, lines or crowds, open spaces, places outside your house, public transportation. In severe situations, a person with agoraphobia may not leave the house at all. They're so terrified of having a panic attack in public that they prefer to stay inside. Now at last we will share 3 simple CBT exercises for people who feel anxious. Be patient with yourself. Change won't happen overnight, so don't expect that if you try CBT on your own, or even with a therapist to guide you. Instead, Your goal should be to build your skills so you feel more equipped to handle whatever challenges your mental health wants to throw your way. Focus on setting yourself up for small victories, then slowly build up your goals over time. Be proud of any positive change you make, no matter how small it may seem. Recognize that progress isn't linear. Some weeks will be easier, others will be harder, and that's normal. Be kind to yourself. It's easy to get caught up in negative self-talk without even realizing it. But constantly getting down on yourself isn't going to inspire the confidence needed to help you feel better. When you notice negative thoughts creeping in, things like "why can't I just get it together?" or "other people don't have this problem," replace them with something kinder. Ask yourself if your friends would ever say the things to you that you say to yourself. No? Then don't allow yourself to say them either. Do what you love. Anxiety, depression, and other mental health struggles have a way of stripping away the activities that matter to you in life, either because you become fearful of them or lack the motivation you once had to pursue them. Maybe you loved to read but now feel tired all the time. Or maybe you used to like going out with your friends but now fear being away from home at night. Make a point of taking time to do one or two things on a regular basis that always used to bring you joy, and do your very best to be present instead of distracted about the past or worried about the future. With that, we come to the end of the video. Hope you liked this video and can share the best part in the comment box. Please like, share, and subscribe to the channel for more videos like this.